The pain you have been quietly carrying for the past several years is not something you simply have to accept. And the surgery you have been quietly afraid of is not what you think it is. I want to address something today that I have watched affect the quality of life of hundreds of my older patients in a way that is entirely preventable. The fear of joint replacement surgery is keeping people trapped in slow progressive decline. And that decline is far more dangerous than the procedure they are avoiding. I am Dr. Hiroshi Nakamura. I have spent more than 25 years working in internal medicine and geriatric health. In that time, I have had the same conversation with patients more times than I can count. Someone in their late 60s or mid-70s comes in for something unrelated, and when I ask how they are moving, how their walking has been, they tell me they have slowed down a little. They tell me the knee bothers them in the morning, or the hip aches on the stairs. I ask whether they have spoken with an orthopedic surgeon and they go quiet. Then they say some version of the same thing. I am not ready for that. I am too old for that. I have heard the recovery is terrible. What I want to tell you today is this. The picture most people have of joint replacement surgery is not an accurate one. It is an outdated one. And holding on to it is costing them something they cannot get back. Stay with me, because what I am about to explain changes the way this decision looks entirely. Let us begin with what is actually happening inside a worn joint. Because I have found that when people understand the physical reality, the surgery itself becomes far less frightening. Your knee or your hip is not failing in some mysterious or total way. The joint itself is a very specific mechanical structure. At the ends of the bones that meet inside that joint, there's a layer of smooth cartilage. That cartilage is the cushion. It is what allows the bones to glide against one another without friction, without pain, without noise. In a healthy joint, you do not notice it is there. It simply does its work. Over decades, that cartilage wears down. It thins. In places, it disappears entirely. And when that happens, bone begins to press directly against bone. That is the source of the grinding you feel. That is where the pain is coming from. Not the bone itself failing, not the muscles collapsing, not the whole leg deteriorating. One specific layer of cushioning tissue that has been worn away. This matters because it tells you what the surgery is actually doing. The surgeon is not rebuilding your leg. The surgeon is not replacing anything that is healthy. What is being restored is that one worn surface. The damaged ends of the bone are resurfaced and fitted with precisely shaped components. In a hip replacement, the socket and the ball head of the femur, and in a knee replacement, the ends of the femur and tibia, along with the surface beneath the kneecap. The leg around it, the muscles, the tendons, the nerves, the blood supply, all of it is healthy and intact. Think of it this way. Imagine a machine that has been running reliably for decades. The engine is sound, the structure is solid. But one bearing inside it has worn completely smooth. The machine starts grinding, it starts seizing. And someone who does not understand what is happening might think the entire machine is failing. But a skilled engineer looks at it and says, the problem is localized. Replace the bearing, and this machine will run again. That is joint replacement surgery. One worn component, precisely replaced. Now I want to address the fear directly, because it deserves a direct response. Most people who are afraid of this surgery are imagining something from decades ago. They have a picture in their mind of long hospital stays, weeks in bed, months of uncertain recovery, a procedure that felt like a gamble. That picture was accurate once. It is not accurate now. Joint replacement is one of the most performed and most refined elective procedures in modern medicine. The surgical techniques have been standardized and refined over more than 40 years of widespread practice. Anesthesia has changed dramatically. The anesthetic protocols used today are far more precise and far safer than what was used a generation ago. Many patients now receive regional anesthesia targeting only the relevant area rather than full general anesthesia, which significantly reduces recovery time and reduces the risks associated with being under general anesthesia at an older age. Here's the part that surprises most people when I tell them. In the majority of joint replacement cases today, the patient is encouraged to stand and begin walking the same day as the surgery or the following morning at the latest. Not because anyone is rushing them, but because the joint is now mechanically sound. The bone-on-bone grinding is gone the moment the procedure is complete. The pain that was coming from that worn surface is no longer there. What remains is the surgical site healing, which is a different and more manageable kind of discomfort. Hospital stays for joint replacement have shortened considerably. Many patients are home within a day or two. The procedure is done. The new joint is in place. The work that follows is rehabilitation, which happens primarily at home and in outpatient physical therapy sessions. The most important chapter of recovery is not in a hospital, it is in your own life. I want to be honest with you. Recovery does require effort. There is real work involved. Physical therapy is not optional. The exercises prescribed by your therapist are the actual engine of your recovery, and patients who follow them consistently recover faster and more fully than those who do not. I will come back to that. But the point I want you to hold on to right now is this. The picture you have been carrying of joint replacement surgery is likely 20 or 30 years out of date. The procedure has changed, the recovery has changed, and the outcomes are, by the data, reliably good. This next part is the most important thing I will say today, and I want you to pay close attention. The real danger is not the surgery. The real danger is waiting. Chronic joint pain does not stay in one place. It spreads. Not the pain itself necessarily, but the consequences of it. And those consequences follow a pattern I have watched in patient after patient. First, the pain discourages walking. This is natural and understandable. It hurts to walk, so you walk less. You sit more. You take shorter routes. You skip the things that require standing for a long time. Then the muscle begins to go. I have spoken about this in other videos because it is one of the most critical and most underappreciated threats to health after 60. Muscle loss with age has a name, sarcopenia. After 60, the body loses muscle mass at an accelerating rate if that muscle is not being consistently used and loaded. Walking, even ordinary daily walking, is one of the primary ways older adults maintain the muscle strength in their legs that supports balance, joint stability, and metabolic health. When pain stops you from walking, that process accelerates. The muscles around the very joint that is causing pain begin to weaken, and as they weaken, they do less of the work of stabilizing and protecting the joint. More load falls on the already compromised joint surface. The pain worsens. The instability grows, balance becomes less reliable, the risk of a fall increases. At the same time, weight increases because the body is moving less and burning fewer calories. Additional weight places additional pressure on the knees and hips. The cardiovascular system receives less of the regular exercise it needs to stay healthy. Blood sugar regulation becomes less efficient. Sleep quality often declines as the discomfort increases. And here is something that does not always make it into the clinical conversation, but that I have observed consistently over more than 2 decades of practice. The person's world quietly shrinks. They stop going for the morning walk they used to take. They stop attending events that require a long walk from the parking lot. They stop visiting people whose homes have difficult stairs. They stop going to the market as often. They stop gardening. They stop dancing, if they used to dance. They begin organizing their life around the pain and around what they cannot do, rather than around what they want to do. And that shrinkage of life is profoundly damaging to the spirit. It is damaging to mood, to purpose, to the sense of independence and dignity that most older adults describe as among the things they value most. I have seen this happen slowly enough that the person themselves barely notices it until someone asks them what they have done this week, and the list is very short. I want to tell you about a patient named Thomas. He came to me several years ago for a routine internal medicine visit, and he was 73 years old at the time. Thomas was a retired machinist, a man who had worked with his hands all his life, who was proud of being self-sufficient, and who did not, by his own description, make a fuss. He had a quiet dignity about him that made it easy to see why people respected him. I noticed he was moving more slowly than when I had last seen him, and I asked about it. He told me his right knee had been giving him trouble for a couple of years. I asked how much it was affecting his daily activity. He paused for a moment before answering, and then he said, "I used to walk to the park every morning. It is about 15 minutes. I have not done that in about 8 months. I asked what else had changed. He told me he had stopped working in his garage as much because standing on the concrete floor for long periods made the knee worse. He had stopped going to his son's house for Sunday dinners as often because the steps into the house were getting more difficult. He had started spending more time sitting in the same chair in his living room. He told me that when he described it out loud, it sounded worse than he had let himself think it was. His knee had been evaluated by an orthopedic surgeon the previous year. The surgeon had recommended a knee replacement. Thomas had thanked him for the information and had not gone back. When I asked why, he said, "At my age, I did not want to go through something that big. I figured I would manage." I told Thomas what I am telling you now. That what he was managing was not just knee pain. He was managing the gradual loss of his daily walk, his garage work, his Sunday dinners with his son, his independence, and the longer he waited, the more muscle he was losing, and the harder his recovery from the eventual surgery would be. Severe muscle loss before joint replacement surgery makes rehabilitation significantly more difficult and significantly longer. Waiting was not protecting him. Waiting was quietly making the outcome he feared more likely. Thomas agreed to be referred back to the orthopedic surgeon. He had the knee replacement. I spoke with him 3 months later. He told me he had returned to his morning walk to the park. He told me the pain he had been living with for 2 years, the grinding sensation with every step, was gone. He said the recovery had been harder than he expected in the first week, and easier than he expected after that. He said something that has stayed with me. He said, "I lost 2 years I did not need to lose." Let me tell you what recovery from joint replacement genuinely looks like when it is approached correctly, because I want you to have an honest picture. The hours immediately after surgery, you will be monitored, managed for pain, and encouraged to begin moving the new joint with the support of a physical therapist. The goal of this early movement is not to test your strength. It is to maintain circulation, begin the gentle process of regaining range of motion, and signal to the body that this joint is meant to be used. The new joint is mechanically sound the moment it is in place. The bone-on-bone pain is resolved. What your body now needs to do is heal the surgical site and rebuild the muscle and movement patterns around the new joint. Physical therapy is the true engine of recovery. This is not something to approach reluctantly or minimally. The exercises your therapist gives you are precisely designed to restore strength, stability, and range of motion in the correct sequence. Patients who do this work consistently, who follow the protocol even on the days when they would rather not, recover more fully and more quickly than those who do not. This is well documented, and it is something I always communicate clearly to any patient preparing for this surgery. A realistic timeline is this. Within the first 2 to 4 weeks, most patients are moving around their home safely, managing stairs with support, and sleeping more comfortably than they were before surgery. Within 6 to 12 weeks, the majority of patients are walking independently and feeling meaningfully more stable. Full strength and full confidence in the joint, the kind where you stop thinking about it with every step, typically comes in the months that follow through the consistent work of rehabilitation. There is real effort in that timeline. I do not want to suggest otherwise. But it is recovery effort. It is work that is moving you toward something. The pain you were living with before surgery was not moving you toward anything. It was only taking things away. If your pain is limiting your life, I want you to hear this clearly. You do not have to simply accept that and shrink your world around it. The right first step is a proper evaluation by an orthopedic specialist who works regularly with older adults. Not a rushed appointment, not a conversation in passing, but a genuine assessment of what is happening in that joint and what your options are. In some cases, there are other interventions worth exploring first. In other cases, the joint has worn to a point where those interventions offer limited benefit, and replacement is the most direct path back to function. But you cannot make that determination from fear and avoidance. You make it from information. If you have already had that conversation and the recommendation was joint replacement, I want you to bring the questions that are actually on your mind. Ask what your specific risks are given your age and health history. Ask what the rehabilitation process looks like and what your role in it will be. Ask what the realistic outcome is for someone in your situation. A good surgeon will welcome those questions, and a good answer will not dismiss your concerns. It will address them with evidence. If this sounds familiar to you, if you are someone who has been living with joint pain and quietly reorganizing your life around it rather than getting it properly evaluated, write yes in the comments. I read the responses, and knowing who is in this situation helps me understand what to address next. The body has a remarkable ability to respond to the right conditions, even later in life. I want to say that clearly because it is true, and because it can be easy to forget when you have been in pain for a long time. You are not too old for this. The data does not support that conclusion. Joint replacement surgery has been performed successfully in patients well into their 80s and beyond, with outcomes that meaningfully improved their quality of life. The conversation about whether it is right for you is not a conversation about age. It is a conversation about your specific health picture, your goals, and what you want the next years of your life to look like. The fear that has been keeping you still is understandable, but I want you to understand what that stillness is costing you. Every season of avoiding the evaluation, every year of quietly managing the pain and walking a little less, is a season of muscle loss, of balance decline, of a world that is getting smaller. And the surgery, the one you have been dreading, is the path back to the morning walk, the garden, the stairs, the Sunday dinners, the things that make life feel like your own. Stop allowing fear to make the decision for you. Get the evaluation, ask the real questions, and give yourself the chance to make an informed choice. If this was useful to you, I would ask you to subscribe to this channel. I release content like this every week, specifically for adults over 60 who want to make better decisions about their health with accurate and honest information. Leave a like if this reached you, and share it with someone you know who has been quietly avoiding a conversation they should be having. Tell me in the comments what has been holding you back, or what a loved one has been holding back. Sometimes naming it out loud is the first step toward changing it. I am Dr. Hiroshi Nakamura, and I will see you in the next video.